We're getting a number of calls asking what should happen if a colleague tests positive for COVID-19. First up, should the rest of the workforce be told? Because there are understandable worries among co-workers, particularly where there are vulnerabilities due to age or health conditions, or the health conditions of family members. And these worries, well, they're only heightened where workers feel that they're being kept in the dark by their employer. So, yeah, your employer should be keeping you, the workforce, informed about potential or confirmed COVID-19 cases amongst colleagues. It's important to note though that your employer should avoid naming individuals if possible, and they shouldn't be providing any more information than's absolutely necessary. Now, the person who's tested positive, they'll need to self-isolate for a minimum period of 10 days. And it's a minimum period because if, for example, the person tests positive when they're not displaying any symptoms, but they then subsequently go on to develop symptoms, then the 10 days, it begins again from the day that they develop the cough, fever, loss of sense of taste, smell, whatever the symptoms may be. So that's the person who's tested positive. But what about colleagues? Does anyone else in the workforce need to self-isolate? Well, the Scottish Government website, it sets out 3 circumstances in which workers will need to self-isolate. So these are where they themselves have symptoms of coronavirus, they live with a person who has symptoms or who's tested positive, or else they've been informed by an NHS contact tracer that they've been in close contact with someone who's tested positive. And it's that phrase, close contact, which is important in a workplace setting. So someone will be identified as being a close contact if they've had direct or physical contact with an infected person for any length of time, or else they've been closer than 2 metres to the individual who's tested positive for longer than 15 minutes. Now, this will be discussed between the individual who's tested positive and the contact tracer, but when your employer is notified of the positive test, they should also be actively considering who those close contacts may have been. Another question we're asked is, does my colleague have to have tested negative before they can return to work? Well, your employer, they should have a policy as to whether they need someone to test negative before returning to the workplace. But when they're putting that policy in place, they should be taking notice of the NHS Inform website, which points out that repeating testing to show that a person no longer has coronavirus, it's not currently recommended for the general public. That's because the test, it can stay positive for several weeks after a person's had coronavirus, but that doesn't mean that they're still infectious. So the basic rule of thumb would be that if they feel well at the end of their 10-day isolation period and they've been fever-free for 48 hours, then they can return. If a negative test result is required by your employer, the NHS Inform website notes that a person can return to work after they've tested negative, so long as everyone in their household with symptoms receives a negative test result too, and the colleague feels well enough and has been free of a fever for 48 hours. So any return to work, it should be discussed with the employer, and a person should only return to work, of course, if they can't work from home. What else then does your employer need to do? Well, if there have been 2 or more confirmed cases of COVID-19 in your workplace within a 14-day period, or an increase in rates of absence due to suspected or confirmed cases of COVID-19, then your employer should be reporting a suspected outbreak to the local NHS Board Health Protection Team, who can then undertake a public health risk assessment. Your employer's own risk assessment should also be reviewed to ensure that control measures are operating as effectively as possible. And when undertaking that review, it'll be worth considering in particular the growing evidence of poor workplace hygiene practices in some places, particularly around offices, social spaces like staff rooms, canteens, locker rooms, and the car sharing or sharing of work transport. There'll be circumstances in which premises or part of premises may need to close, in particular if a significant proportion of the workplace are needing to self-isolate. And consideration should of course also be given to how best to deep clean areas in which affected members of staff have worked. Should you or a member of your family need advice and support on any aspect of what we've attempted to cover in this video, give us a ring on 0800 0015 022 or drop us an email info@scottishhazards.org. And we'll do our best to try to provide some clarity in an area where there is a lot of confusion. All our advice is free and confidential and aimed at helping prevent the spread of this virus, keeping you and your families safe and healthy.